Hi, I'm Mayor Michael Taylor. Welcome to the 2020 Virtual State of the City. For this year's event, I've had important conversations with experts on the topic of the coronavirus pandemic and racial justice and equity in Sterling Heights. For this segment, I've talked to a panel of experts about the public health crisis and what the city can do to respond to it to ensure that all of the residents of Sterling Heights remain safe. Hello and welcome to the 2020 State of the City of Sterling Heights address. For our first segment, I have a panel of public health experts here to talk to me about what we can do in the city to promote the public health and make sure everybody is as healthy and safe as possible. Joining me today, I have Bill Rodella. Bill Rodella is the director of the Macomb County Health Department. He has a master's in public health and business administration, and he's been leading the county's effort to combat the coronavirus. I also have Barbara Rossman with me. Barbara Rossman really needs no introduction here. She is a great friend of Sterling Heights and has been for many years. Barbara serves as the president and CEO of Henry Ford Macomb Health System, and she has a nursing background and is actively involved in too many organizations in the community for me to possibly name. Thank you for being here. We also have with us Dr. Nick Gilpin. Dr. Gilpin is an infectious disease physician at Beaumont Health System. Dr. Gilpin is also the Chief Medical Officer at Beaumont Hospital Grosse Pointe and the Director of Infection Prevention and Epidemiology. I'm going to have you, Dr. Gilpin, explain to us what all that means. But we're honored to have you with us here today for this very important topic. Before I get into our panel's discussion, I do want to make one statement. We know with the coronavirus pandemic, information is changing hour by hour, day by day. As we tape here today, we have just been told by President Trump that he and First Lady Melania Trump have tested positive for the coronavirus. We wish them well and a speedy recovery. And this is a very sober reminder that 7 months on, this infectious disease remains with us. So it's very timely for us to have this discussion about what we can do as a city to help keep everybody safe. So Bill, I want to jump into the discussion with you. We recently received a report from the county that over the last about 3 weeks, we've had over 300 confirmed cases in the city of Sterling Heights. And diving into the numbers, more than a third of those cases are among people under 30 years old. And it could be as many as half of those cases are coming out of our Chaldean community. When this pandemic first started, we saw that the African American community was hit very hard by it. What can the city do to help these vulnerable communities like the Chaldean community in Sterling Heights to reduce the numbers and get things back to normal or as close to normal as we can?
We got to realize that Macomb County is very diverse today. And I think that diversity is very, it helps the county. I mean, it helps us in many ways with the opportunities that present here. And I think with COVID, we've seen vulnerable populations hit. We know that initially when this first wave came in March, we were seeing more elderly people impacted. And age, of course, and having underlying medical conditions is definitely a concern when it comes to COVID. But over time, we saw a reduction of the cases in June. But again, in August, as things started to open up, we saw more cases. And within those cases, when we saw more people having social events and getting together, that's again where we saw, we kind of put our guard down. You can't be complacent with a pandemic. Right. You have to continually practice the community mitigation things that we all know about and continue to practice those. So I think some of the messaging that can be done within some of our communities is the constant use those personal preventative measures, the wearing of face masks, the hand washing, the social distancing, and really trying to avoid those crowds. It's difficult when you've got family weddings and People want to have graduation parties. So all of those things impacted that wave that went up in August. So again, I think that the measures that we need to take are continued community education, let leaders know, and let people understand what the data is. They hear these numbers, but they really don't mean a lot to people. So I think there's a clear understanding of breaking down that into common terms and being culturally sensitive, making sure they're in different languages too, and I think that's very valuable.
As a politician, as somebody who's involved in government, we're used to getting out, shaking a lot of hands, being in crowds, meeting a lot of people, and that's how I think all humans are. We're sort of accustomed to that. These numbers, though, they tell you that we're getting, you said we're letting down our guard, we're getting too comfortable getting back to normal. Is it time yet to get back to normal, or do we still have a long way to go?
I think that, number one, we don't have a vaccine. And I think that's what people need to realize. This is a lot different than the flu. We have vaccines for the flu. We know a lot of people don't get the vaccine. But again, we do have hospitalization and deaths. Last year we had over 22,000 deaths within the country from the flu. But again, the importance of taking action on a routine basis, and people need to realize this could go on for another year easily. We don't have a vaccine. We've heard that there's some in manufacturing. It's a different type of vaccine, but until we have vaccine, and what we've heard, more people protected through herd immunity, where more people have built up immunity from the infection, we can still have transmission. So we're going to have COVID for still a while, right, and we need to be working together. And I think better together, cities, counties, with communities is going to be very essential.
Absolutely. Now, Dr. Gilpin, I want to ask you as an epidemiologist, when you hear that what Bill was talking about, spikes and valleys, and that it's now impacting younger members of our community, whereas before it was older members of the community, and it's impacting different ethnicities differently. What does that tell you as an epidemiologist, and what can we learn about that so that the city can be better prepared and better protect our residents?
Well, first of all, thanks for the opportunity to be here. I think one thing I want to put a stake in the ground on is that this is the same virus that we were dealing with back in March and April. There's nothing fundamentally different about the virus itself, but we are seeing different populations of people being impacted, and I think Bill hit the nail right on the head. Back in the early days of this pandemic in March and April, when our healthcare systems in Southeast Michigan at large was really overrun, it was the African American community, it was older, more vulnerable populations. Now, I think we've put a lot of those groups on notice about their risk factors and their potential for complications from this virus. What we're seeing now are, frankly, a younger population of folks that don't feel that they are as at risk for getting this infection, putting themselves at risk by, frankly, ignoring some of the public health guidance that we put out. And I think this is a perfect opportunity to kind of snap folks back into focus on some of these issues. And that's exactly what we've been doing in our communities and in our hospitals and healthcare systems. When we see a cluster or when we see an uptick in disease activity, we use that as an opportunity to really snap folks back into focus. People get relaxed. We're all, frankly, tired of social distancing, and we're all tired of wearing masks. But those are the things we have to continue to do to mitigate this transmission.
No, I couldn't agree more. We've done in the city of Sterling Heights a number of public service announcements. We've gotten into those vulnerable communities and talked to members about what they have to do to keep themselves safe. And I think you're absolutely right that when it gets to younger people, it's harder to get that message across. I want to bring you in the discussion. Barb Rossman, you and I have partnered on public health initiatives for years, and you've always been a champion of the city of Sterling Heights and been involved in our State of the Cities in years past and community leaders breakfasts and things of that nature. You're no stranger to getting the message out to the community, and I think the community knows you and trusts you. How do we do it? What more can the city do to make sure that people who I know they've heard the message, but they're not buying into it? What more can we as a city and the the health community do to partner to make sure that message gets across?
Well, I'd like to echo the comments that have been made already, but first, thank you very much for this opportunity, Mayor, to be out in front of our community to talk about this. We cannot say enough all the points that have been made. Wear our masks and wear them properly, and that means over our mouths and our noses. Wash hands and social distance. If folks notice, we are social distancing and we are still wearing our masks unless we're speaking. What we do know about the public is when it comes to vaccines, to Bill's point, when the vaccine comes out, that people trust physicians, they trust nurses. So I think the partnership the city's doing with healthcare and with the county health department is very, very important, because we can reiterate the messages with you over and over that when, in addition to what we're doing now to protect ourselves, the point that Bill had made earlier too, that when the vaccine is out, it will take probably a couple of doses and it will take herd immunity. And to get to that, we've got to get to at least about 70% of the population to have it even become effective in that way. So we're going to have to be preparing people now to continue to believe this is real and that the vaccine's going to be more important now than ever for this in order to get to that point of herd immunity, which we do get to with the flu when people vaccinate themselves with that. So I think it's us continuing to work together, engendering trust. And I think another point that was made that's really important is it is hitting young people now. We're seeing it as we're seeing upticks in our hospitals of those patients admitted. Those young people go home to their grandparents and their parents, and then they infect them, and then we have grandparents and parents back in the hospital. That's what we have to prevent.
No, you're absolutely right, and it's a concern I have as a parent of 3 young children. That schools are obviously on the top of a lot of people's minds, and getting kids back into school, but then they come home and there's teachers and there's parents, and so there's a lot of those potential exposures. Bill, I want to bring you back in and ask you about Sterling Heights specifically. I know you're the director for the entire county, but some very concerning data that I just saw this morning, and this, as we're taping this, it's early October, but we are about double of where I would expect Sterling Heights to be. I think we make up about 15% of the county, and we're around 30% of the cases over the last 3 weeks. What would you say to that? How do you account for that, and what do we need to do about it?
Early on, Sterling Heights was not one of our cities where we saw cases here, but they were much lower than what we were seeing in Warren and East Point in the southern portion of the county. Middle of August, we saw a significant increase in cases in Sterling Heights, where population-wise, you're about 15-16% of the county as far as population, but as far as cases, that went up to almost 33%. So a third of the cases. It has gone down a little bit over the last week. And we've seen a little bit reduction in the younger people, but again, that's just a week. We got to keep looking at over this data much longer than a week. So yes, the numbers in Sterling Heights went up. As you mentioned earlier, we were seeing some increases in the certain zip codes, and again, part of that was within our Arabic-speaking population, and so we saw some increases there. And I think again, a lot of this was due to what we were hearing from our case investigations was that there was a lot of household contact and close contact, and individuals who were attending events. And that's when you have events, and we got to realize, 20% of our cases are asymptomatic. So it's when you're asymptomatic, your transmission of the virus is a couple days before you even know you've got the illness, and of course a few days afterward. That's when you're most infectious, and that's when I think a lot of our community transmission and again, is being spread. And I think it's important when we call the public to do case investigations, and I say the health department, it's important we speak to people, talk to the close contacts. We need to get better at that and have more trust that when we're calling, we're not sharing your information with anybody. It stays in a confidential data system, but we're trying to prevent additional infections.
I understand. And so what you're saying is you see trends going up and down in the county, and unfortunately it's spiking in Sterling Heights right now. I'd like to ask you, Dr. Gilpin, as a treating physician, one of the things we all bought into early on is that the hospitals were overwhelmed. And I know you were part of that, probably working around the clock to treat patients, save lives, and your staff was probably overworked, stressed, and we heard stories about how it was impacting the hospital staff. Luckily, it seems that the hospitals are not at that critical capacity anymore, but is that reason for us to let our guard down? Talk to me about what's happening in the hospitals right now versus what happened before, and why you think it's still critical that we employ masks and social distancing and all those safeguards.
Yes. So back in March, April, heat of the pandemic, I work for Beaumont. I think it's fair to say we were absolutely crushed. We had at one time, I think our peak number of patients at any one moment was over 1,300 spread across 8 hospitals. We cared for thousands of COVID patients. I like to say we were kind of living paycheck to paycheck in terms of our ventilators, our beds, our PPE, our testing supplies. It was very touch and go. And through it all, the staff, and I'll talk about the staff a little bit more, but dealing with those precious resources became our MO. I mean, it's always about taking care of patients, but the mission was to protect the staff and to preserve the PPE at all costs, because if we didn't have those things, we wouldn't be able to take care of the patients. Happy to say that, we survived. We made it through March and April. We've seen since that major tidal wave, it's been relatively flat. As of today, I think we were down to around 120 patients with COVID spread across 8 hospitals, a much more manageable number, still significant. I'm happy to say that my healthcare system and presumably other healthcare systems as well have done a fantastic job of stocking up, making sure we have enough PPE to accommodate another surge should it happen. I think we're much more well-suited to test. Our testing supplies, our testing capacity has improved. We have better treatments available. We have better protocols. We have better science, frankly, than we did 7 months ago. So all of those things are in our favor. The thing I still worry about is staff. It's our nurses, it's our physicians, it's our respiratory therapists, it's frankly everybody that works in our hospitals day to day. There's a lot of scar tissue there, and there's a lot of emotional and psychological concern that we're going to have to go through something like March and April again. And we beg the public to please do the best they can with all of the things that public health is telling us to do, with the masking, the social distancing, hand hygiene, preferring outdoor activities over indoor activities, getting your flu shot. And these are just basic fundamental public health principles that will really help keep these numbers down. And just to put a finer point on it, I like to talk about Australia. Australia is sort of the canary in a coal mine for the United States when we think about flu season. In Australia, their flu season runs from April through around October. And Australia had a fantastic flu season this year, meaning a very mild season, very few flu cases. And that's all attributable to 2 things. One, the mitigation strategies that we're all talking about, the masks, the social distancing, all that, and much better uptake of their flu vaccine. They had about 50% improvement in their vaccine uptake for influenza. And that really kept not only their COVID cases down, but it kept their flu cases down as well. So I think we can learn a big lesson there and really take that out to the public.
Well, thank you for that. I want to ask you, Barb Rossman, about that as well. As the CEO and president of Henry Ford Macomb Health System, is that your experience? Have you seen the surge that we saw in the spring obviously has tapered off, but are you concerned about a fall resurgence with the flu season coming up now? How important is it from your standpoint that everybody gets their flu vaccine and takes other mitigation steps similar to what we're doing with the coronavirus? And what keeps you up at night as we go into this fall and winter season?
Well, I would like to echo what Dr. Gilpin is talking about, quite honestly. We're actually starting to see a bit of uptick in terms of our inpatient admissions positive with COVID and an increase in the severity of illness of those patients right now. And I would just reiterate what he offered. Getting the flu shots and getting them now couldn't be more important than any other time, because it will help to mitigate what we might have if we have a combination, if someone were to have a combination of flu and COVID, which we did see in the early months of the pandemic period, and it was very, very difficult then with the severity of illness. So it's critical. We couldn't reiterate that more. We are actually almost requiring our staff, encouraging them to get them before the end of October. We have a deadline of December the 1st. However, we've started already, and we're encouraging as many to get in by the end of October as possible. And while we offer them in the system and encourage that, we're saying wherever you can get it, and we're making.
Tell the residents watching, where can they get a vaccine? What's the best way to get it? Bill, do you want to take that?
Bill is craving to answer that question.
Well, in fact, I think everybody knows by now, besides your healthcare provider, there's many of them have it, and many pediatricians are vaccinating children. And so many pharmacies now carry it. I mean, you can't turn on the radio without hearing about a pharmacy advertising. But again, your healthcare providers, your pharmacists, and at the health department, for years we've been providing flu vaccinations, and we've set up 2 drive-through flu vaccine clinics. So you don't even have to get out of your car. And this is one of them is in the Mount Clemens location, right in where we're doing our COVID testing. So days we don't do COVID testing, we do flu vaccines, and we also are doing them in St. Clair Shores. So we are partnering with others too to do more mobile flu vaccinations, so you'll be seeing more of that. But I'll just say Macomb and Michigan are not high flu vaccine communities. We need to do a much better job, as you said. Australia did a 50% increase. Wearing the mask, washing the hands, all the community mitigation things are going to help prevent flu just as it will COVID. And we need to do that too. But on our website with the county is a list of places to get COVID testing as well as flu vaccine, and that's also on the state website. So very valuable resources.
Great advice. And Dr. Gilpin?
There's one more thing I want to mention here, and it's another mitigation strategy we haven't really talked much about, but that's the fighting this notion of presenteeism. You know, I think that we as a society we're industrious and we're hardworking, and we genuinely want to go to work even when we're sick. And I think this year, now more than ever, that's really untenable. We really cannot encourage people to show up for work when they're sick or having symptoms. We really need to take the opposite approach and encourage people to stay home. That means people that are working should stay home. That means businesses should respect their employees if they're sick, that they should not require them to come in. Same goes for school. I think that when we're sick, we need to stay home, plain and simple.
Absolutely, great advice. We're running low on time, but I want to ask a question and give each one of you an opportunity to weigh in on. We're coming into the fall season now, which means that we're accustomed to big gatherings with family and friends. First is going to be Halloween, and then a few weeks later is Thanksgiving, and then, of course, the Christmas season. Any short tidbits of advice that you can give for families out there wondering how to navigate through this holiday season? Bill, I'll start with you.
Well, I know already for Halloween, the guidance is out there. The CDC has published guidance. The state of Michigan has kind of piggybacked off that, and they are available on the website. In fact, we're putting that on the county website because we do want to, have children enjoy a holiday. Our candy company's got to make a little money. That's important. But also at the same time, we need to practice social distancing, and we may have to avoid that door-to-door activity, and maybe that's going to be important. So there are some very safe things to do, and figure out some ways, which are, again, many of these are online, to have events for kids that, again, there's going to be minimal interaction.
Sure. So that CDC guidance is on the county's website. We're going to have it on the city's website as well. So that'll get pushed out on our social media too. So good advice, Barb Rossman. Moving on to Thanksgiving. I mean, this is the big one. For a lot of families, Thanksgiving is the most important holiday of the year, and it's an important tradition. What are we going to see going into November? What should we be preparing for?
Well, first of all, I want to reiterate how impressed I am with what the city of Sterling Heights is doing and has been doing relative to making its residents aware of what's safe and what's not safe. It's so difficult to ask families not to get together, but to Bill's point, CDC has very clear guidance on the size of gatherings. The governor does as well in her executive orders. One of the things that we don't know as large families and can't be certain of is where the other person truly has been and how they have handled themselves when they're there. We'd like to say everybody washes their hands, use social distancing, wears their mask when they're with people that they don't know, but we know that doesn't happen. So I think the benefit of virtual, we found some very innovative ways to get together as families during the height of this epidemic, or this pandemic, excuse me. I think we need to use those virtual events, keep the gatherings small, and remember that we're accountable not only to ourselves, but to each other for protection and to help not have this spread go any further than it already has.
Absolutely, and I think you know where this is going, Dr. Gilpin. I've got 3 little kids who love to sit on Santa's lap and tell him what they want for Christmas. I mean, are we going to just have to start getting our minds wrapped around the fact that this is not going to be a traditional Christmas holiday season this year?
Yeah, I'm going to sound like the Scrooge here, but Barbara said it well, and I think I would add that we tend to think of our health as a personal issue. We need to refocus and think of health in a public lens now more than ever. This is not going to be a big year for big family gatherings, unfortunately. It's going to be a great year for coming up with novel approaches to celebrating some of these holidays that we cherish. It might be, grandma and grandpa on Zoom while we open presents. We're just going to have to get creative in that space. I think the days of having 25 people over and and celebrating Thanksgiving, Christmas, or any other holiday for that matter is going to really be challenged this year, and rightly so. I think that we're going to have to take a pause on some of those things while we pivot to make sure that we keep our communities safe, while we keep our COVID and our flu numbers down. Christmas will be there next year. Thanksgiving will be there next year. We can hopefully get our arms around this thing and look to brighter days ahead.
Well, I want to thank you all for being here. This has been a tough note to end on. So why don't we do this? I want you to give me in about 20 seconds or less, why is there reason for optimism heading into the new year? And what do you think, Dr. Gilpin, we have to look forward to?
I'm optimistic because this isn't our first rodeo, right? This is the biggest pandemic that we've seen in our lifetime, but we've faced major public health challenges before, and this country always finds a way, and we will continue to find a way. We're already very optimistic about the prospects of a vaccine. We're getting new and better treatments and protocols all the time. We're learning and we're using science to our advantage, which is what we're supposed to do. We're adapting and we're advancing. So even though we don't know what the next several months are going to look like, I'm optimistic that things will continue to improve in the long run and we will get through this.
Barbara Rossman, what are you most optimistic about?
We all are sounding like broken records in a way, and it's great because that means that we agree with each other. I'm very optimistic also. It's not in the time frame that the general public wants it, but we know there are vaccines on the way. Henry Ford Health System's been involved with one of the largest ones, the Moderna trial, and we're very optimistic about that. And so I think it's a matter of appreciating what we have, being cognizant of that, remembering that, and just knowing that we're going to be back to some new normal very soon.
The importance of being patient. We're not always patient, but be patient and spend time with your family. Support one another, especially any of your older. And I think that we're resilient. Human mankind is resilient, and we will bounce back from this to be better. And this is a global pandemic. So we're working together with our partners from across the globe to find those scientific solutions in vaccines, in better strategies. And I think that's important. I think that'll build these relationships with our global partners in a better way, and it'll be better for our country and for our communities.
Well, what brings me optimism is that we have a panel of competing hospitals, we have the public health, we have the county, we have the city, and we're all in agreement that we have to take these mitigation steps. We have to take this seriously, and we have to continue to stay the course in order to maintain the public health, because without the public health, we've seen it, we can't have schools open, we can't have businesses open, we can't have restaurants, we can't have movie theaters, we can't have sporting events, we can't have all the things that we enjoy. So I want to thank you all again, Bill Rodella, Barbara Rossman, Dr. Nick Gilpin, for joining me. I greatly appreciate it. The information that you shared with us today is going to be incredibly helpful to the 135,000 residents of Sterling Heights, and we're seeing that resurgence, Bill, so we need that information to be pushed out. So I want to thank you all again. Thank you for joining me for that very important discussion. I'm Mayor Michael Taylor. This has been the 2020 Virtual State of the City. For other important segments like the one you just watched, join us on our city's YouTube page at SHTV1.